In order to describe SimBioSys' fight against cancer, you have to look at evolution in areas like weather forecasting, where data and science were brought together to provide credible predictions that drive our day-to-day. Or the navigation industry, where tools like Google Maps determine how a journey is taken and planned, and that's completely transformed how we live our lives. We've taken principles like that and from both these areas and are applying it to a problem that's incredibly personal to all of us. It's cancer. So what we've developed is a platform that allows us to virtualize a patient's tumor and accurately provide predictions on the response to therapy. This enables us to create a selection of the right drugs for the right patient that would ultimately improve outcomes, and our future aspiration is to help find the cure against cancer.
The basic idea for what we're doing is to try to build computational models of individual patients' tumor. And that's not just the tumor, it's also the surrounding tissues, the vasculature, what chemical species are available to the different cells in the simulation. And all of that really comes together into a really comprehensive picture of the biochemistry at play and the way that the different cells are interacting. And what's come out of that is the realization that the morphology and the surrounding tissues really play a major role in how tumors grow and respond. Our technology really comes from the bottom up. It's what's going on in the tumor and how that drives tumor progression or treatment.
What's really unique about our approach is that it's based on GPU computing technologies, which allows us to actually predict the response of a patient 2, 4, 6, or even 12 months in the future just within a few hours. From a user's perspective, everything is automated. So the TuberScope integrates directly with their electronic medical records software to pull out the relevant information, send it off to the cloud, compute the predictions, and then bring that back to the physician for easy consumption and treatment planning.
Our initial push is on breast cancer, one of the most common cancer types in the world, and for which there exists a ton of data that shows that there's the potential for improving patient responses while lowering overall toxicity. As we look forward, a number of other solid tumors are ripe for similar approaches. These include lung, prostate, pancreatic cancer, and ovarian cancers, among many others.
Our goal is to get the SimBioSys application in the hands of oncologists as quickly as possible. In order to do that, we've begun partnering with a number of health systems across the country, leading clinicians, a number of researchers in very similar places, as well as patient advocacy groups. What this will allow us to do is continue our validation, but also allow us to expand our technology to other solid tumors.